Your oral health is an important component of physical health, and researchers are finding new reasons to brush and floss. An unhealthy mouth, especially if you have gum disease, may increase your risk of serious health problems such as heart attack, stroke, poorly controlled diabetes, and preterm labor. Dental surgeon Dr. Steve Baul is saying, don't take your oral hygiene lightly. Today he talks about flossing.
It's one of the best things you can do to prevent gum disease because it doesn't matter how much you brush, your brush doesn't get, it's impossible for it to get in between your teeth unless you have spaces in between all your teeth, right? But it's impossible, it's physically impossible. So you need the floss to get in between your teeth. And in my experiences, a lot of the very big, the large fillings that end up needing root canals or extractions, they actually start in between the teeth, right? And there's actually research to show this, that a lot of cavities start in between teeth. So flossing definitely helps with that. And a lot of people might get discouraged from flossing because they don't do it correctly. Most people, they don't floss enough. You should try to floss at least once a day. The way you should floss is you floss first and then you brush. So you're cleaning everything out from between your teeth and then you're brushing it away, right? So ideally, before you go to bed, your regimen should be after you eat, floss, brush, and then you can go to sleep. A quick demonstration of it, you should get maybe about a foot and a half. And very importantly, this is something that a lot of people make the mistake with. You wrap the floss around your middle finger, right? A lot of people wrap it around their index finger, but the middle finger is better because you get to use your thumb and your index finger, which you have a lot of control over, to get the floss in between the teeth. Because you can now wiggle it in between the teeth rather than pull it and injure your gums, which will definitely discourage you from flossing, right? So when you're flossing, you want to just hold it between these two fingers and you wiggle it in between the teeth, and then you go underneath the gums and you just make a C shape around the tooth, like if you're making like a C. And what you do is just make some upward motion. You can do it about 3 times, and you get whatever is in between the teeth out. As you continue to do it, you realize how simple it is and how quickly you can get it done, right? You don't have to invest 5-10 minutes with it. Within 2 minutes, you can be finished, because in actuality, you're basically cleaning 2 teeth at a time, right? So flossing, invest in it. Once you start flossing, you would feel your mouth feel cleaner right away, and you will not want to stop. So definitely, if you would like to save yourself some gum disease, save yourself some cavities, and save yourself some big bucks, definitely start flossing.
My advice to you is take care of that smile, and it will take care of you. This is Access Health GY, a program where we discuss health issues, discoveries, success stories, fitness, and more. Join me next week for another episode. Goodbye.